Actually, exercise is mandatory. It's one of the more important things that the people have to do at any age, and especially when they are old, because we have a lot of research showing the impact in longevity and in functional capacity. Our research in this area in the last 10 years has been focused in the effect of exercise across different diseases. For example, obesity, diabetes, cancer, EPOC. And in the last years, we are quite interested in examining the effects of exercise in other people in nursing homes, how the exercise improving functional capacity, exercise in the hospital. Very important to do exercise when the people is in the hospital, and exercise programs as baby frail in the community. These kind of events are very important because integrate the much more important things for all the people: nutrition, exercise, and medication. Actually, these disciplines are prescribed independently. So in this kind of events, we can learn one from the others and to understand that we have to mix the effects of exercise in conjunction with medication and also the effects of nutrition. This is the key of the prescription.
So I guess evidence has been accumulating now for many, many years, showing that people who follow a healthier diet, particularly one that's rich in plant-based foods, is protective against age-related diseases and is also linked with better longevity. So people who follow more kind of plant-based diets, like a Mediterranean-type diet, tend to live longer and to be disease-free. So a lot of my research looks at healthy dietary patterns and either cardiovascular health or brain health. So I'm speaking today about our work on brain health, where we've looked at dietary approaches like the Mediterranean diet and more recently our UK-specific healthy eating model, the Eat Well Guide, and how following those dietary approaches is linked to better brain health. Many reasons why it's important to bring researchers from different areas together. One, I guess, is to learn from each other and to kind of break out of your silo of just focusing on your own niche area. And the other is that I think with increasingly complex public health problems like different non-communicable diseases, the best way to tackle them is by focusing on a kind of multi-pronged attack from different perspectives. And you can only really do that if you work with people from different fields.
Our gut microbiome is absolutely linked to aging in terms of frailty as well as healthy aging. So we know that as we get older, our gut microbiome composition and function can change, and particularly for females as we enter menopause, there's a real sharp decline in the diversity of our gut microbiome and it becomes more similar to the male gut microbiome. At Yakult UK in Ireland, we're really pleased to be partnering with King's College London on a randomised control trial looking at the gut-skin axis. So specifically looking at how bacteria and particularly probiotic can have an impact on inflammatory skin outcomes in perimenopausal and postmenopausal women. I think it's so important for various disciplines to come together at events like this because I think whether you're a researcher, an academic or a healthcare professional, you bring such a unique perspective and such a wealth of information that can be so valuable to various different audiences that can ultimately have an impact on patient care.